Alaikum doctors. In this video I am discussing a very famous recall communications. It is about celiac disease. It is an information giving communications. A task come that diabetes patient who has some features, and we do some test biopsy result and it is positive for celiac disease. Now we have to talk with this. Okay. So as usual, remember some important point here. We will involve the dietitian, GP, general pediatrician and gastroenterologist. So as usual, we start with IRCAP. I am really sorry to tell you that the test run for Jisan came positive for a case called celiac disease. Then give him a pause to speak. Have you heard about it before? No. What is this? So it is a disease that affecting his gut. Can you please follow me at this drawing to make myself clear? Okay. So we draw a picture of a gut and the defense systems. There is a protein. So when Jisan eats protein called gluten, which present mainly the wheat and barley, it stimulates the defense system. Normally our defense system act as a soldiers against the germs and bugs. But in this celiac disease, after being stimulated by this protein, it will attack the gut itself and leads to destruction of its inner layer. So Jisan cannot be able to absorb the nutritive element of the food and he will have diarrhea. So what happens, we will draw a picture of gut and defense system and the protein, gluten protein. We'll explain like that. Normally, normal and abnormal. Normal is that our gut is, there is a defense systems which actually act as a soldier against germs and bugs normally. But in celiac disease, what happened when Jisan eat a protein called gluten, which is mainly we find in the barley and wheat, then it actually stimulates the defense system, and defense system causes, it attacks the gut itself and causes destruction of the inner layer. So he cannot be able to absorb these nutritive elements and he will have diarrhea. OMG doctor, is there any treatment for this? Unfortunately, there is no medical treatment, but the best treatment is prevention. Do you agree with me? So what do you mean? By preventing Jisan from eating this protein while giving a chance for the inner layer of the gut to build up itself again, and this diarrhea will stop and Jisan will be able to absorb the nutrients from the food. Okay doctor, so how long he will be stopped eating this protein? Unfortunately, it is for lifelong. Say it's sad voice we can say. Then OMG doctor, do you imagine what will happen to the baby? How can he eat cakes, sandwiches? I really understand how do you feel, and I can understand it is really difficult, but now in this era we have many products gluten free and almost same taste as normal food. For that, we will have a meeting with the diet doctor who will teach you exactly what should he eat and what should avoid. And I can reassure you there are a lot of alternatives. Kudre, oats and barley replaced by corn flour, rice, potato, lentil soup and pure maize. Are you with me? Okay. So, okay doctor, I think it is very difficult to do these foods at home. Getting it from outside is so expensive for me. We'll discuss it with the social service to get it solved without any burden on your economic status. Okay. Also, we'll need to check him up every year at least to make sure that he is sticking his diet to measure his weight and height. Am I making myself clear? Okay. Also, in some children, not all children, they may have increased risk of some disease caused by this defense system in Jisan's body, like diabetes and thyroid affections, pointing to your neck. For that, we need to measure his blood sugar and to test for thyroid function test every now and then. Am I clear? Clear doctor. Is it running in genes? Actually, it is not running in genes, but tend to be clustered in families, and that is why we need to check his brothers and sisters. Then as usual, trusted website, written leaflet, support group, diet doctor and meeting. Thank you.